Public health authorities in Cameroon sound the alarm bell as fake chloroquine floods markets, warning that the drug in circulation is void of any curative properties for COVID-19. Anxiety and frustration collude in hospitals in Yaoundé, where quarantined passengers from Europe were expecting to go home after clocking the statutory 14 days, but are yet to be delivered a medical clearance. As fatality increases and the number of cases kicks, government re-angles its anti-COVID-19 strategy to slow its spread in the country and ensure an efficient follow-up of confirmed cases. Those are our top stories. Hello, the 7:30 news on the CRTV. I am Ben Menopufong. The National Laboratory for Drug Quality Control and Validation is announcing the circulation of fake chloroquine on Cameroonian market. According to a release from the laboratory, the chloroquine in circulation is void of any active reagents and thus cannot in any way be used as cure for COVID-19. The laboratory and the WHO are therefore putting the public on their guard against this contraband and falsified chloroquine, which they are now ignorantly buying in quantums as remedy for COVID-19. Beatrice Ngum sounds the alarm bell.
Chloroquine is not a cure to COVID-19. Medics in Cameroon are clear, and the National Drug Quality Control and Valuation Laboratory has taken its stand. In a press release, the laboratory has vehemently decried the activities of some unauthorized individuals who have injected contraband chloroquine into the market.
WHO have sent us an alert to tell us that they were fake anti-malarial medicines, and it was something written quinine sulfate, but when they test it, they didn't see any quinine sulfate inside.
Chloroquine, according to the laboratory, in the past was used to treat malaria, but for close to 2 decades now, the drug is no longer in circulation in Cameroon for medical reasons.
Chloroquine has been used for many years and has been banned because it was having adverse events, especially for African population.
Today, many have taken pharmacies by storm in search of chloroquine as treatment to COVID-19, whose prescription...
I don't know who told Cameroonian that to prevent COVID burden, they need to have chloroquine tablets in their home pharmacy. Let us let this problem of chloroquine, because we are going to take fake and toxic medicines that will create another problem.
Medics also warn on the adverse effects of automedication.
We have more and more people suffering for hypertension, cardiac failure, cardiac problem, and so on. When those people will now go and take chloroquine, they have no idea of what is going to happen.
The contraband chloroquine on the market, Lanacom says, comes from two sources. Some unscrupulous businessmen bring it into the country through the porous borders, and some is produced by some individuals in some hideouts in Yaoundé.
They looked up with expectations for this day that marked the 14th and last, but they may still have to hang out there for some time again. They are passengers who flew into the country from Europe on March 17, 2020 and were quarantined in some hotels for preventive measures. Their hopes were dashed as by 5 o'clock this evening, no medical clearance had reached them for them to go home. Constantine Baum captured some of the low moments of their great expectations in the following report.
Some of the 254 passengers who came to Cameroon from Europe on March 17, 2020 are quarantined in this hotel at Mvogada. They have been confined by the government in order to monitor the incubation period of COVID-19 if symptoms of the virus will develop. Today, March 31, counts 14 days and is supposed to be the last day for those tested negative to go home to their families. For 14 days, their rights were seized because of the COVID-19 pandemic. Many had waited for 11 a.m. today to leave the hotel, but were surprised that by 5 p.m. no official statements from health officials has been made on their clearance. A few faces could be spotted on the balcony when they noticed CRTV cameras. Some courageous ones came out from the hotel to express their frustrations as to why they are still kept at the hotel. Law and enforcement officers were on board to monitor the situation, and they will get them back to the hotel. The situation is very challenging, but the state has to be very sure that those who will be given the clearance to go home will not be a threat to their families and the society. Martin Amugu is one of the many family members around the hotel waiting to get their loved ones back home. He has to pick up his cousin who came in from France. His cousin's bag is already in the car, and he is just waiting only for the government to say he's free to go home. COVID-19 is real, and the number of Cameroon's infected persons keeps increasing, reason why government is taking time to redo and confirm the test in order not to put the society at risk.
And according to sources at Cameroon's Ministry of Public Health, some of those passengers quarantined in those hotels will have to stay back again as they tested positive for the disease. Beatrice Losamba was around these hotels to gauge the atmosphere that prevailed there and brought back this report.
As it happens in a typical action film, police arrives the scene to make sure a delicate but dire operation goes safely and uninterrupted. Scores of the March 17 flight passengers who came in through the Yaoundé International Airport have been quarantined in this hotel for the last 14 days, time required to detect they were not vectors of the virus. Impatient to go home and tired of waiting for their release, tempers seemed to have fled inside, and police get reinforcement in case the fortnight occupants got more violent. Outside the hotel, nearby traders get worried over the tense atmosphere as family members wait to finally hug their loved ones coming from the journey. Only 2 weeks of wait has been unbearable. Before the medical team comes with their release report, bags are smuggled out of the hotel. This man calls orders to his relatives from the window of his hotel room and succeeds in getting his bag into the car, doubling police vigilance. Not all the time, though, fortunately so. The quarantined flight passengers were unaware of the Ministry of Public Health report that some of them have tested positive and would have to be retained again. In this case, their luggage could be a source of contamination to their relatives in whose hands the bags would end.
And on to some positive notes that coming out of the ongoing fight against the COVID-19, the two coronavirus-treated cases discharged from the Jamoh Hospital in Yaoundé yesterday have returned to their homes. The medics say they will ensure their continuous follow-up and the recovered coronavirus patients are expected to report back to the hospital after 14 days for a last and final check. Ewan Epole visited the hospital to inquire about measures taken to ensure they reintegrate mainstream social life without remorse or fear of stigmatization.
These persons who have recovered from the coronavirus infection after receiving treatment at the Jamoh Hospital were happily received by their families. But this doesn't mean that their medical follow-up has ended.
The government is to make a multidisciplinary team. So in this team you have psychologists who will be in charge to contact person to help them to live with the situation. The team have to reconfort the family and give them advice concerning this disease.
Meanwhile, other measures have been taken to ensure their full reinsertion in the society.
At the period of quarantine, they have to identify what is good for them, because it's a difficult period if you have to stay at home every day, like at the hospital. It's not easy. If you like to dance, you can dance. If you like to sing, you have to do it. They don't cut the relation with the health personnel. We used to call in order to know if they have problem, if there's something to do for them.
According to the medics, they are expected to report back to the hospital after 14 days for the final test. It is only then that they will be declared totally safe from the coronavirus disease.
With the number of cases of COVID-19 increasing nationally, government has stepped up its response mechanism to attend to the swelling number of cases. One of the 4 strategies recently outlined by the Ministry of Public Health is providing quality care to infected persons and increasing capacities to quarantine suspected persons. Cynthia Saptala now reports on how these new measures are being deployed on the field.
As the number of cases of the coronavirus now exceed 150 nationally, the government, through 4 new strategies, has decided to improve on its response mechanism in order to contain the disease. With the general testing that will be done from April 2nd, the current areas reserved in hospitals and lodging facilities for quarantine have now been multiplied.
Aujourd'hui, nous avons disponibilisé
Today, we have made more space available in hospitals. We have also included low-cost housings, which will serve as quarantine centers. We have 550 in Yaoundé, 650 in Douala. We have in the West region and others. As we generalize the testing, there will be more patients to cater for. That is why we are trying to provide more beds.
In terms of care given to more serious patients, medical experts say necessary measures have also been taken.
Il y a en plus de cela donc bien sûr les lits avec
with the necessary equipment in this isolation unit. Patients will have all they need for the 14 days in quarantine. There will also be oxygen supplies for those patients who need it.
Permettent d'oxygéner les patients qui le nécessitent.
They also add that not all patients with the virus need ventilators, and should the need arise, there is a solution.
In the Yaoundé Central Hospital, measures have been taken to receive severe cases of the COVID-19. 30 more beds have been equipped and the hospital produces oxygen in case there is short supply. For now, these equipment are sufficient provided there is no increase.
Nous prions tous que le nombre de cas n'explose pas.
From personal protective equipment, beds and supplies to test for COVID-19, officials reassure that Cameroon can still contain the disease if and only if citizens follow measures prescribed by WHO and the government and report symptoms earliest. The first contingent of Cameroonians who were stranded on West African soil following the outbreak of the coronavirus have been flown back home. The special Air Côte d'Ivoire flight transporting them landed at the Nsimalen International Airport this evening, and all the passengers were treated to a thorough check and disinfection process before being ferried to confinement hotels in the nation's capital. Charles Ebune reports on the repatriation operation that is being spearheaded by the government.
Only a few workers are spotted at the Nsimalen International Airport, and amongst them are those to disembark stranded Cameroonians in Côte d'Ivoire because of the coronavirus. To allow them back home, the plane is completely disinfected. Then the passengers, including their luggage, all of these to meet the guidelines established by the government through the Ministry of Health in a world controlled by the coronavirus today. This is followed by another round of medical control. The nearly 100 Cameroonians, 82 from Côte d'Ivoire today, adds to the already 371 Cameroonians repatriated by the government. They will be quarantined for 14 days in government-established centers in Yaoundé, according to the coronavirus-imposed regime.
And before we continue in this newscast, we have this communique that is just coming in from the Prime Minister's office, and it reads, "The Prime Minister, head of government, Joseph Dion Gute, hereby makes public the decision of the President of the Republic, His Excellency Paul Biya, to create a special national solidarity fund for the fight against the coronavirus. The head of state has already given firm and urgent instructions to credit the fund with 1 billion CFA francs to finance operations related to the response strategy against the spread of the coronavirus pandemic in Cameroon." And that release has been signed by the Secretary General of the Prime Minister, Seraphim Fuda. The Cameroon Academy of Sciences has saluted efforts of the government, medical staff and partners in ensuring that the national response strategy against the COVID-19 bears fruit. The Academy has further launched a fervent call on the populations to respect the personal hygiene measures and social distancing, as well as ensure that bars, restaurants and other leisure sports close at the stipulated 6 p.m. Here is an excerpt of the statement made by the president of the Cameroon Academy of Sciences, Professor Sami Beban Chumbo, selected for us by Gilbert Ongene.
The Cameroon Academy of Sciences, through this statement, adopts the following positions in the national response to COVID-19 pandemic. The Academy encourages government to invite and fund research in biomedical and social science in order to enhance understanding of the dynamics and local specificities of the spread of the SARS-CoV-2 in Cameroon for the development of contextually appropriate and effective prevention and treatment strategy. We call on the public to heed government and the scientific community's advice and information, and not to be fooled by social and other media propaganda about fake or potentially harmful preventive or curative measures. The Cameroon Academy of Sciences stands ready to fully assist government with its expertise in contributing to the containment of COVID-19 pandemic in Cameroon.
Professor Beban Sami Chumbo there, speaking on government efforts to fight back the coronavirus in the country. Meantime, the government has made available medical equipment, including 2 ambulances, to the Bamenda Regional Hospital to boost the facility's efforts in fighting against the spread of the coronavirus. Northwest Governor Adolphe Lele-Lafrique announced the government measure upon his return from Yaoundé, where he attended an interministerial meeting on COVID-19. After visiting some bus stations and market squares, Mr. Lele-Lafrique observed that the region has to double its efforts in barring the way to the virus. From Bamenda, Winston Lebger reports.
Not even Governor Lele-Lafrique is treated with laxity here at Matazin in Santa, the gateway to the northwest. The authorities insist that everyone must be screened as one of the anti-COVID-19 measures, and government is putting some backbone in the efforts.
The head of state is conscious of the situation. He's taking measures to equip our health centers, our medical teams, and the ball in our court to implement those measures to prevent the virus to enter our region.
The gubernatorial convoy surprises the driver of this red bus, violating the measure against overcrowding in vehicles, and he has been booked. In the markets, people are adapting to new ways, and they've got new needs.
We have made contributions and we have bought our buckets, our hand sensitizer, there is water, we wash our hands. We are just trying to do it because it's difficult to educate a common man. Some people don't want to believe that it is a reality.
The Northwest has not yet recorded a case of infection. However, the regional hospital has been busy getting this solidarity word ready to handle any eventuality.
The University of Buea is also taking stringent measures to curb the spread of the coronavirus, whose infection tentacles are already spreading into the southwest region. The institution has created a special campaign dubbed UB Stop COVID-19 Task Force, which it is using to sensitize public through a radio program on the government measures against the spread of the pandemic. Tanjan Levis Agbo reports from CRTV Southwest.
From shutting down schools and suspending classes, which was one of the prescriptions of the government to curb the spread of the COVID-19, the University of Buea has proceeded with UB Stop COVID-19 Task Force to sensitize the public on the COVID-19 and why they should adhere to the measures put in place by the government and the World Health Organization to fight the pandemic. During a special radio program on CRTV Southwest, Professor Lucine Ayambandip, Deputy Vice Chancellor in charge of Research, Cooperation and Relations with the business world and coordinator of UB Stop COVID-19 Task Force, emphasized on the need to respect the preventive measures against COVID-19.
The university created a Stop COVID-19 Task Force. We will be going out to sensitize, and one of our missions is to make sure that all the measures put in place by the government are fully respected.
The panelists expatiated on government's measures put in place to fight the disease, saying it will go a long way to prevent its spread.
Even in the Southwest, we have people who are suffering from different infections, HIV, TB, malaria, which makes their immune system to be compromised. So we must make sure that the measures that have been implemented by the government are strictly followed.
The University of Buea is also working on an e-learning platform to enable students learn from home to avoid physical contact with lecturers.
But not all. We now take you over to the Emergency Operations Center and the Ministry of Public Health, where our reporter Rainatu Sali is posted. Rainatu, we are getting information that the number of confirmed cases in Cameroon have climbed up to 209. Are you confirming those figures?
Good evening, Ben Meno Pufong. Well, we've been told that 16 new cases of the COVID-19 have been confirmed in the country, making it a total number of 209 cases in the country. Quite disturbing figures there. Now, the day of today was marked by the repatriation of Cameroonians from Côte d'Ivoire. 82 of them, they are back in the country. Now, another Cameroonians will be repatriated from Swiss. They'll be coming in from Swiss in a couple of hours. The last set of Cameroonians will be coming in through the Turkish airlines. Now, my guest is Dr. Eric Tandy. He is a public health expert in the Ministry of Public Health. Now, Doctor, good evening.
Good evening.
Now, tell us what arrangements have been made to ensure that those Cameroonians who have been repatriated, those who are already in the country and those who are yet to arrive will be quarantined.
Thank you very much, Sally. I should first of all make mention here that even though we have 209 cases that have been confirmed, 10 have also been treated, or 10 have also been freed. They have now been managed and they are out of the hospital facility. Coming back to your question, I think in the few days that have passed, the government has put in some measures in order to curb or receive those who are coming in. For example, the Minister of Public Health with the Minister of Territorial Administration had a joint meeting with the governors, with the various governors, in order to decentralize on how to manage this situation, which therefore means that they have made allocation of social housing that will receive those who are coming in, so that they should be confined under respectable and good condition in order to be monitored and see if within the incubation period they have issues or not. I think those are the measures that have been taken for now as far as those who are coming in are concerned.
Now, there were some Cameroonians who were in confinement. It's been 2 weeks already. Their confinement ends today. What is their situation? Are they going home? Are they safe?
Thank you very much for a very pertinent question. Remember, in confinement is just a period of observing. We want to observe the 14 days occupation periods for this COVID-19, and all those who were quarantined or confined within this period, if after the 14 days they get tested and their results are negative, they have all the rights to be free because their results are negative. So it is actually safe for them to get back to normal life.
So all of them are going home?
Yeah, for those who have been tested that are negative, and then they have all the free right to go home. But let me say something here. Despite the fact that they're going home, they have to continue respecting all the government recommendations that have been given, and also the prescribed preventive measures that you and I already know, and I think the general population already knows about this. So they have to continue respecting all the preventive measures that have been earmarked both by the government, both by the Ministry of Public Health and the WHO.
Now, to fight in the country, President Paul Biya has created a solidarity fund with an amount of 1 billion CFA francs. What message do you have for Cameroonians of goodwill who might have the intention of chipping something in? The president has set the ball rolling.
Yeah, Sally, thank you. You know, when we are faced with crisis like this, we don't know how long this crisis is going to take, and any little thing that comes in will help. We are all at war now, and I can say the war of COVID-19 is something that is affecting everyone, and every Cameroonian of goodwill, just like the head of state has marked or has set the ball rolling. It is a good initiative. It does not prevent others of goodwill, because I know there are many others, especially our experts or sports experts or veterans are willing to do this, because we need to come into synergy to see how we could put our heads together through either financial support or material support, or even psychological support, just like the medical staff is doing, and other supports that are meant to fight this kind of disease that we have in our community that is quite challenging.
Thank you very much, Dr. Eric Tandy.
Thank you very much for having me.
Now, Ben, we have 209 cases in the country already. Cameroon has hit the 3-digit number. Well, there's hope in the horizon, though. 10 people have been cured already. And as of today, we have been told that 2,537 calls have been received in this center, meaning Cameroonians are calling the call for different reasons to share their symptoms, to find out what they need to do and how they need to keep safe from the COVID-19. Rayanatu Sali for the 7:30 News.
Thank you very much, Rayanatu, for those updates from the National Emergency Coordination Center pitched up out there into the Ministry of Public Health. And let's continue, and let's now turn our attention to talk about the global situation of the coronavirus as the number of cases and deaths keep rising across the world. South Africa is currently the worst hit nation on the continent, with over 1,300 infected cases of coronavirus pandemic, while the United States of America tops the chart with close to 18,000 cases and as many as 3,400 deaths. Gerald Nanji is here with the latest global figures as at 6:30 p.m. Cameroon time.
Towards the fight against the COVID-19 heightens across the globe, so too are the figures changing by seconds. In Africa, South Africa is the highest hit on the continent with over 1,353 infected cases, but with just 3 deaths. Algeria has 716 infected persons with 44 deaths. They are closely being trailed by their North African brothers, Egypt, that has 656 infected cases with 41 deaths. Tunisia has 362 infected cases and 10 deaths already. Burkina Faso, for its part, accommodates 264 cases and have lost 12 persons in the process. Meantime, Nigeria has 135 infected persons with just 2 deaths. On a global scale, the United States of America tops the chart with 176,518 infected cases, with 3,431 deaths. Italy, on its part, has 105,792 infected cases, with 12,428 deaths already. Spain has 94,417 infected cases with 8,269 deaths. China, the hub of the coronavirus, harbors 81,518 infected cases with 3,305 deaths. France, on its part, has 44,550 infected cases with 3,024 deaths. In total, 828,305 confirmed cases of the COVID-19 and a total of 40,735 deaths has been recorded as from 6:30 p.m. Tuesday, March 31st, 2020.
And we close this chapter on the coronavirus with this press release from the Director General of the Cameroon Radio Television, and it reads, the CRTV has noticed with indignation that its Twitter account has been hacked by a fake and uncouth account using the same CRTV web, but web with double B. The Director General of CRTV hereby calls on users of the internet to be vigilant on such web hackers who unfortunately use the logo and visual platforms of the CRTV to deceive the public. During this difficult period, the communique continues, when the government has prescribed basic hygiene measures against the COVID-19 pandemic, some persons with obscurantist agenda are seemingly not concerned with the urgency of the health crisis and are instead drawing attention towards inappropriate issues. And it has been signed, Charles Ndongo, the Director General of the Cameroon Radio Television. And you're watching the 7:30 news on the Cameroon Radio Television. We are beaming live from Yaoundé. On to other news now. Cameroon now has a national switch infrastructure for the electronic payment and supply of value-added services. The project, developed by the Ministry of Posts and Telecommunications, is a hub which provides mobile payment operators to use a single means to offer services by mobile phone or the internet to users of mobile phones. The launch in Yaoundé today brought on board ministers, directors general, and ICT experts who see the innovation as a digital economy breakthrough for Cameroon. Emmanuel Avamue reports.
The magic code is #237# for every Cameroonian wishing to access the national switch payment infrastructure, irrespective of mobile network.
With that platform, you can access to all the people in Cameroon who have mobile number. It means that the market is now open for everybody. We want to link it with financial inclusion.
A system seen as one which promotes Cameroon's digital transformation and financial inclusion facilitates transactions between mobile operators who can now easily reach a wide range of consumers at reduced cost while fighting against ills like tax evasion and terrorism funding, amongst others. Governments, banks, and microfinance institutions, merchants, and customers through this hub can easily trade, while startups find a large market for their inventions.
It's always a difficulty to, go about contracting with each and every different telecom provider or the financial sector before putting a solution out there. But with the national payment switch being live, it acts as a one-stop shop where a software developer like myself can quickly deploy the single set of standard application programming interfaces and put the solutions out in the market as fast as possible.
It is thus a platform that takes the Cameroon's digital transformation to another level.
More than 400 billion CFA francs have been invested in the water and energy sectors in Cameroon within the last 10 years. The funds raised through the public securities helped the state to boost its share in counterpart funds for the execution of some of these water and energy projects. In continuation of our series on the contribution of the treasury bonds of the state to the state's development agenda, focus tonight is on its impact on the production and supply of water and energy in Cameroon. Crise tells us.
216 megawatts of electricity, meeting 20% of the country's energy needs. This has been the job of the Crise gas plant since 2013. Natural gas supplied by the National Hydrocarbons Company and transformed into energy. Inhabitants of the seaside resort town of Crise are the first beneficiaries.
Generally speaking, the energy supply is on part. Compared to other cities, I believe energy supply in Crise is better. The only challenge in Crise is that it is of recent that we have this challenge, and I believe probably they're upgrading the system, and probably because of rainy season that is starting. Most time when the rain is about to start, they cut off the light. Usually there is light. We have less problem as to compare with before. Before there were no light, they were cutting light all the time, but with the evaluation, as things are moving more better as to compare with before. Now, always, all the time, there's light in the town.
Other energy projects have been executed thanks to funds raised on financial markets. Treasury bonds, which enabled the state, contribute its quota in counterpart funds to push through with their development. Meanwhile, water supply has been stepped up in a number of localities across the country. For instance, the 122.8 billion CFA francs project to provide homes in Yaoundé and its environs with potable water from River Sanaga will have a 300,000 cubic meter per day capacity upon completion. Boreholes have also been constructed in numerous towns. In 10 years, 400 billion CFA francs has been invested in the water and energy sectors, resulting in the creation of tens of thousands of jobs. Institutions in charge of overseeing the production and supply of both commodities equally received funds to keep them running.
The demolition of sites on which the new edifice of the National Assembly of Cameroon will be erected at the Ngwaikele neighborhood of Yaoundé is near completion. House Speaker Kavai today made a round of some of the earmarked areas to appraise the progress of work and to assess the measures taken to relocate the different departments of the lawmaking chamber. Kmer was with the House Speaker.
At the vast backyard of the current House chamber, the boring machine echoes decibels as it drills to attain 20 meters of the preliminary test for the pile foundation, an indispensable procedure to determine the resistance of the foundation on which will rest the 14th story, as explained to House Speaker Honorable Kavai by the follow-up committee for the project, accompanied by the Chinese construction company. While the earthwork is 80% complete, pending the demolition of the residence of the President of the Economic and Social Council in a week at the Gendarmerie Mobile Squadron, the excavation is over and the groundwork for the contractor's work camp with prefab assembles is noticeable. In relation to the relocation of the institution's personnel, Honorable Kavai inspected the Parliamentary Institute of Yaoundé under construction, the National Assembly Infirmary, and the sites where deputy speakers and the parliamentary groups will be lodged. As he applauded the execution rates, he called on the payment of dues by the contracting insurance company still pending 2 years after the unfortunate fire incidents. That notwithstanding, the team remains upbeat.
We have about 100 containers who have already arrived at the Douala port, and those containers will come here by the middle of the April.
3 months gone, the construction of the new edifice is expected to be delivered in 39 months.
The 7:30 news on the Cameroon Radio Television. That's the way it was this evening. Thanks for the charm of your company.